So, good afternoon. Thank you for joining our educational webinar on the versatility of omega-3s in athletes, sponsored by Nordic Naturals. I'm Katie Knappenberger, and I will play the role of moderator today. I'd like to introduce you to our presenter, Tavis Piatoli. Tavis Piatoli is the Education Program Manager and Sports Dietitian for the Taylor Hooten Foundation, where he speaks to athletes, coaches, parents, and healthcare professionals on the dangers on appearance and performance-enhancing substances, dietary supplements, supplement safety, and sports nutrition. He is also the co-founder and director of sports nutrition for My Sports Dietitian and the Eat to Win nutrition app, which provides a multi-level sports nutrition education platform for athletes, coaches, parents, and sports medicine professionals through the use of technology and guidance of a sports dietitian. He currently serves as the sports dietitian and nutrition consultant for Fairchild Sports, Performance in Houston, Traction Center for Sports, and Covington Orthopedic. He is also an adjunct faculty for Concordia University of Chicago's Exercise Science Department, where he teaches graduate courses in vitamins and minerals, sports nutrition, and exercise nutrition for weight management. As a 17-year veteran sports dietitian, he has worked with dietary supplement companies on product formulation and education. He is a regular presenter and lecturer at local, state, and national conferences and universities on the topics of dietary supplements in young athletes, dietary supplement safety for high school, college, and professional athletes, omega-3s for athletes, and sports nutrition principles for athletes. Tavis currently serves on the Science Advisory Board for Examine.com and Nordic Naturals, and was the sports dietitian for the Louisiana High School Athletic Association's Sports Medicine Advisory Board from 2008 to 2015. Let's discuss a few logistics for the call. All of your phone and computer lines are muted and will remain muted for the duration of the call. If you have questions, please submit your question under the question tab as part of the control panel on your screen. I will moderate them and ask Tavis as the conversation flows, and I may also answer your questions by typing a response. With that being said, welcome, Tavis.
Thank you so much, Katie. I appreciate it. I'm excited to be here and really looking forward to this topic. I know it's a topic people have a lot of interest in, and always kind of play around with some of the slides and have expanded some things. So really excited to share this, and got a lot of information for you guys today. About 102 slides. We're going to try to get to it and get all the information covered, but most importantly, I want to leave some time for questions at the end. So let's just get started. Versatility of omega-3 for athletes. So what are omega-3 fatty acids? We have really two core fatty acids we're going to talk about today, but as you guys know, these are polyunsaturated fatty acids. They're essential fatty acids. We need to get these from the diet. So EPA and DHA, we get a lot of questions, well, what's really the big difference? I mean, these are found in fish, algae, and krill, so there's not much different there. The EPA, we need these in higher quantities to kind of get those benefits, where DHA, the body converts some DHA back to EPA to keep those levels equal. So that's why these two really work synergistically. They're really important to have together. Then you have ALA, which we see in some plant-based foods, leafy vegetables, flaxseed, which, you know, we see a lot. Should we take flax seeds? Is there a benefit to consume flax oil? But unfortunately, ALA, only 1% of this is converted. So it's really an inefficient way to get omega-3 in the body. Food sources, obviously, we want to consume this from our food sources first if we can. But if you're someone like me and you don't like certain types of fish, like I'm not eating anchovies, I'm sure not eating sardines out of a can. So I'm a believer in, I personally take fish oil. I love some salmon, but I don't eat enough of it. So obviously the majority of our high sources of omega-3 are going to come from fish. And then we have some non-animal based or non-fish based sources coming from flax and chia. But as we talked about, the conversion to DHA in EPA is only 1%. So not a great source there. Lots of benefits. To me, omega-3 is one of the, if not the most versatile nutrient that we have available. I personally think unless you have a medical condition, everybody should be taking a good dose of omega-3, and we're going to talk about that today. But these are just some of the things that we're going to talk about today. We're going to actually cover a lot of these different areas when it comes to omega-3. There's others that apply, but this is what we'll focus on for the athletic performance side. Now, we also hear that omega-6 are really bad. We should never consume omega-6s, and that's really not true, but you know, we have to look at the balance. So these are also polyunsaturated fatty acids. they're also essential that we need to consume from the diet. And there's a couple of different types, as you can see, linoleic, arachidonic, and also gamma linoleic, where they all come from different sources, mostly oils, cooking oils, the soybean, the safflower, the peanut oils, the hemp seeds. So there's some decent sources here that, we need to have a little bit in our diet, because not all omega-6 is bad. When we have the right balance of 6, we still have some of the same benefits that omega-3 provides. And if you look at some of these, we're going to actually talk about the benefits of omega-3 for ADHD. Although it's not athlete driven, we do have athletes that have these conditions. So we're going to talk about why this is extremely versatile. So not all omega-6 is bad. We hear a lot, so much fear mongering going in our industry that never consume this or never eat that, but everything we do should be about balance. Now, if we look at the omega-6 sources, and we'll talk about what the current ratio is right now, obviously a lot of things we cook with or cooking oils are going to be in these products. I mean, we're going to talk about soybean oil shortly, but a lot of our food products today, they use soybean oil in place of a lot of the products. And I'm going to show you where that exists in a lot of the products today. And that's where really in the late 1960s, we saw a significant rise in the use of soybean oil in our country, mainly because these products are really this is an inexpensive ingredient to use in our food supply to make these products less expensive and more profitable for the food industry. So where do we get a lot of our omega-6s from? Margarine, shortening, and vegetable and seed oils, a little bit from nuts, some other miscellaneous options, and then even things like grain-fed chicken are going to have some omega-6. Now, the problem, again, is just that soy oil production that we've seen in the U.S. We went from not even a pound to the early to mid or late 1900s, all the way to 1999. You can see 25 pounds per year, and that's probably continuing to grow. Now, what's the relationship? If you look at other countries, that little graph on the left, you can see, the United States has probably some of the highest levels of omega-6 intake. And keep in mind, look at Japan and Greenland. We're going to come back to that shortly when we talk about omega-3 index scores, because that's an important blood marker to evaluate. When we look at mortality in tissue and in omega-6, obviously mortality rates in tissue fat are much higher in the U.S. because we have a higher level of omega-6 fatty acid consumption. Now, again, there's nothing more exciting than we talk about data in chimpanzees, but here's kind of the correlation. When you look at linoleic acid or omega-6 increase over the course of the last 50 years, we've seen tissue fat and body fat in these individuals elevate because of the way they were fed. Our diets are just so abundant in omega-6. Tons of products that are omega-6 driven, very pro-inflammatory because we're consuming 20 to 1 omega-6 to omega-3. So it's not that omega-6s are bad. It's just the abundance of our diet is so omega-6 driven. And again, a lot of the culprits, I live right outside New Orleans. We're known for our food and culture. A lot of fried foods, especially now with crawfish season, in full swing. Fried seafood is very, very popular here. You combine that with other ingredients and, you have an elevated risk for inflammation. And here's a perfect example. You look at this product, and on the front label, it's got omega-3, EPA, DHA, and ALA. But if you look at the blend of oils they use, we know there's really not much omega-3 in here, because if this was used for fish oil and butter, that is not going to be a great tasting butter, and we're not probably going to put a fish oil tasting butter on our bread or any type of spread. So they use canola, palm, fish, flax, olive, and soybean. So 6 different types of oils go into this product, and that's kind of how a lot of these companies deceive us today. Same thing with a lot of our mayo-based products. Even some of the things that say olive oil at the bottom, olive oil is used. It's the first ingredient or second ingredient after water, then canola, then vinegar, but then still some soybean oil. So we don't really know what percentage of what is being used in these products. What we do know is when there's a 1-to-1 ratio of 3 to 6, blood vessels are better, lower lipid count, so improvement in those markers. What I find key is the reduced risk for plaque buildup. And that's important because if you're trying to manage cardiovascular disease or reduce your risk, that's one thing we want to have, because unfortunately we tend to look at cholesterol, which I think is a useless marker, especially today with so many other markers that are very beneficial when it comes to cardiovascular disease. But doctors look at that one number, and then based on that one number, they're like, here's a statin. And unfortunately, that doesn't really improve our outcomes. Now, what does, and something that we're going to start seeing very soon, in some places we see this already, but omega-3 index is kind of a much, I guess, much more predictive marker, in my opinion, of what's going to happen to cardiovascular disease. So this is a simple blood marker, just like anything else. It looks at the sum of EPA and DHA in the erythrocyte membrane, but physicians don't test for it because, obviously, in my opinion, if we want to be blunt and honest, they're not going to get compensated for this by how much they're prescribing when it comes to pharmaceuticals. So pharmaceutical industry wants their drugs to be prescribed, and this is not something that's probably going to hurt their drug prescription because people are going to be taking something like omega-3 instead. So what we do know is high risk, you're less than 4%. Very low risk for disease, your numbers are 8% or higher. And when we look at countries that are 8% or higher in green, you see countries like Greenland, Japan, Okinawa, Nigeria, Papua New Guinea. These are all Norway. These are all countries that have an average high score of greater than 8%. But look at the U.S. and Canada, less than 4%. This is why inflammation is so high, because we're not only taking crappy fish oil, but number two, we're not getting enough omega-3 in our diet. And here's kind of some great data looking at the effect of omega-3 index on coronary heart disease. You can see as scores go up to 8% or above, the odds ratio for that disease is significantly lower. When we look at sudden cardiac death and cardiac arrest, you can see as those scores went up above 7.3 and above 6.3, those odds ratios are significantly lower. So this is why it's so important to look at this number when it comes to risk for coronary heart disease. All right, we've seen concussions. Obviously, we know concussions is a big deal, but I'm not just going to focus on concussion because a lot of us have seen John Oliver's study. I'm going to show you that if you haven't, but I really want to show you a lot of different things because the brain is 60% fat. 25% of that is DHA. So if we're not feeding it the right type of fat, it's going to be hard for the brain, to really function over the course of time. As we get older, the brain builds up plaque, and our amyloid plaque builds up in the brain, just like plaque builds up in our arteries and our heart. So if we look at brain health, when there's an injury, there's a lot of different things that occur that'll lead to cell death, from metabolic errors to getting rid of ATP reserves, disruption, calcium influx, all the stuff that we look at. It's not really exciting to look at, but it's just the pathway of what happens to where we break down and we don't have antioxidant systems that supply our brain with health, and there's a lot of neuroinflammation that happens. And here's kind of, those neuroprotective effects of why DHA is so important. So, we release DHA from the cell membrane, and it gets into the brain because 25% of that brain is DHA. So once it gets into the brain, it provides a neuroprotective effect. It's an anti-apoptotic effect where there's very little cell death. Now, it's impossible to probably prevent cell death from happening, or maybe traumatic brain injury. And we'll talk about that, with football and hockey and certain sports and how that impacts. But it does have an anti-inflammatory effect on the brain. And you can look at omega-3 fatty acid intake and just kind of see how does this benefit the outcome, from neuronal cell survival, obviously the reduction of cell death or apoptosis, oxidative stress improves, more plastic brain, and then neurotransmission that occurs. Now let's look at a lot of the different data from different outcomes. So if we look at brain development, women we've seen with low omega-3 scores, they do pass this on to their newborns. So, if you're a female and you're thinking about getting pregnant, this is a great time, if you're not taking omega-3 or eating fish with omega-3, to start doing so, because increasing that intake can enhance the maternal DHA status of that child. I love talking about this because we look at two different outcomes of mothers who ate fish 4 times a week during pregnancy. Those babies had higher developmental scores at 18 months, and those children whose moms had 2 grams a day of omega-3 at age of 4 had significantly higher IQ tests. I use my daughter as an example. She's going to be 8 next month. Again, you look at the data and it makes sense, but my wife breastfed her for 2.5 years, so obviously that's an important component. But I also started giving her liquid fish oil at 3 months old. And we just, again, it's an N = 1. But when you look at her development, her ability to speak and read at those ages, it was significantly better than a lot of her kids in her class. And again, I'm going to say, hey, it was the fish oil, and mom's going to say it's the breastfeeding. But the combination of both is really critical there. These next couple are not athlete driven, but I thought it was important to share this because, we have people that we run across with these conditions. I mean, you look at autism spectrum disorder, they gave omega-3 based on the size of the individual, and every single marker of autism spectrum disorder improved, from performance to symptoms to functionality to behavior to social response. I thought that was impressive. So could that mean obviously we're saturating the brain with omega-3, we're raising blood omega-3 levels, and it's helping some of those symptoms. Now, I'm no autism expert. I don't know all the I guess the biology of autism and what causes and what happens in the brain. I just know that from this study, omega-3 have improved those outcomes. ADD and ADHD. 16 randomized controlled trials looked at over 1,500 kids and looked at kids with ADHD at baseline, gave them a dosage of 9 to 3 to 1 EPA DHA to GLA, and what they found was 13 of those 16 studies showed favorable benefits, and we'll show you what those results were shortly. But the key thought that I thought was most important is they were able to reduce the dose of medicine, whether it was Ritalin, whether it was, and I'm losing my brain, but Ritalin and the other ADHD medicines that they have for kids. But if we can reduce that medicine and reduce those type of outcomes, that's going to be important, because what we saw was all of these outcomes improved: activity, impulsivity, attention, visual learning. And that's pretty critical, because we see this being diagnosed and treated pretty frequently. I think it's 7 or 8% of our kids now are being diagnosed with this condition. And could we supplement instead? That might not have the acute effect, and that's the problem, is we need that acute effect to happen pretty quickly, because some kids are not going to be able to behave well in school. We look at depression, and you look at countries that are very low in depression, and you correlate that to their fish consumption in pounds per person per year, and we saw, obviously, in these Asian-based countries of Korea, Taiwan, Japan, less depression. And that's something we need to look at pretty closely, because we look at the world of social media today, and there's a lot more depression in kids because they're not connected. They don't have that social interaction because they're connected more to a device than they are to people. Alzheimer's disease, we talk about plaque buildup in the heart. There's plaque buildup in the brain. There's obviously Alzheimer's, and dementia is a very important condition we need to look at. And this is something where even once it's diagnosed, we need to look at, possibly this is a therapy. It's not going to prevent, I can't say it's going to prevent or it's the best treatment protocol, but it's something that we need to open our minds and go, hey, we need to include this as part of the protocol, because will it reverse it? And I think that's something we need to continue to examine, because this is also an inflammatory condition of the brain where cytokines are inflamed. There's a lot of different things going on in the brain where there's also effects of anti-inflammatory drugs that happen. So typically we want to give these individuals prescription-based medicine, but again, another N equals 1, a close friend of mine's father has it, and after sending her a couple of bottles and going through it for a couple of months, she said, hey, Dad's remembering things better. Again, that's just an example. That doesn't mean that's what's happening, because I'm never going to say you take this and it's going to cure all these things, and all of a sudden I'm going to wake up running sprints in the street. It doesn't happen that way, but you have to take some of those things and go, okay, wow, we do have actual improved outcomes based on what I'm hearing. But we need data to prove that stuff. And why does this happen is because what DHA does is increase the production of this protein, LR11, which is found at reduced levels in Alzheimer's patients. So when we can elevate LR11, it can destroy the beta amyloid plaque associated with Alzheimer's disease. And that's important because, hey, if it can do that, then why isn't it part of the treatment protocol, and why haven't we used that? So I think it's just outside of the box thinking. Doctors want to just give traditional-based medicine because it's quick and easy. And again, of course, our diets, we're not going to spend a lot of time on this side, but our diets, so inflammatory based, it's probably not helping, along with the genetic risk. And of course, so what's the role of omega-3 for athletes? A lot of concussions in youth sports, a lot of history here, and a lot of things that we want to focus on. And I know this is a big area with a lot of athletic trainers, and we've seen topics over almost 4 million concussions probably by now that are happening in youth sports. And you can see, there's a lot of concussions in a lot of different areas. And obviously the NFL is a very profitable industry, and there's a lot of attention in that area. But we have to really look at youth sports probably more than anywhere else, because as you can see, there's a ton of concussions going on in youth sports. And this is just kind of a picture of the brain of, if you look at a 65-year-old control subject with a healthy brain with no abnormal TAW or protein deposition, and you look at a former NFL linebacker, and then you look at a former world champion boxer, both these were really CTE happening in the brain. And, I look at individuals, I take like Ray Lewis. This is a guy that played 17, 18 years in the NFL, played middle linebacker, probably had microtraumas every single play he was in there because, not only was he one of the best, if not the best middle linebacker of all times, but he was aggressive and was pretty much in on most of the plays. So I look at guys now and say, let's look at the progression of somebody like Ray Lewis or Brian Urlacher. Let's see what happens in the next 5 or 10 years and how their body progresses, because they've had a ton of microtraumas over the course of time. Right now, the current treatment for concussion is removed from play, obviously physical and cognitive rest, but there's some new data that I just saw that regular light exercise can help improve symptoms and improve outcomes. But right now, there's really nothing for neuroprotection or neuroinflammation or helping that brain regenerate. I think we've seen some new data, or not just new data, but new approaches to where a lot of our sports dietitians are including fish oil as part of this process. Hopefully after this, they're going to include it even more. But you look at, where did this all start? Where did we start thinking about omega-3? Well, Julian Bales is one of the guys. Him and Dr. Michael Lewis and Dr. Bales were kind of the ones that really started getting innovative when it came to this, because here was, again, an N=1 teenager with severe TBI, auto accident, Glasgow coma score of 3, which means deep unconsciousness, subdural and small temporal hematoma. So basically, this was a kid in the vegetative state, put a trach and also a peg tube and started enteral feedings, was not given the weekend to live. Well, Dr. Bales and his team started giving them 16 grams of omega-3 via the peg tube, and 10 days later, they weaned him off the ventilator and began rehabilitation 3 days later. Remember the mine explosion that happened in West Virginia? Well, one lone survivor out of 14 people, this individual suffered from respiratory distress due to elevated CO levels, lung collapse, unresponsive, comatose. Same thing, gave high doses of fish oil via peg tube, had full recovery. Again, all N=1s. What we've heard is this doesn't happen every single time, but if we're not at least attempting it, if you know somebody that is, hey, they're brain dead, and there's nothing else that's going to work, why not try it? Because if they're going to pull the plug, then, if we've not exhausted all of our resources, then we're not really fully trying to save the person's life. This was really kind of the first study that looked at doses of omega-3, though, in a controlled environment. Unfortunately, you had to take rats as volunteers because they're probably not going to raise their hands. And this was kind of an awful study of what you have to do to rats. So basically what they did was they took a couple of different groups of rats and then just slammed their heads in the wall and gave them a concussion. I don't want to laugh, but every time I tell that story, it's kind of like no one's volunteering for that, right? We're not going to get a bunch of adults to say, all right, take me and throw me and drop me off a couple of floors and let's see what happens to my head. So 2 groups where they supplemented them with either 10 or 40 milligrams kg per day of omega-3, and one group had no supplementation. And what was really interesting is this just looks at the values of what happens in the body. So obviously, those that had the highest dose had the highest level of omega-3 fatty acids for those rats. But what was interesting is those that had those supplements also had a very little impact on the brain. So they showed quicker recovery, obviously, than those that had no supplement at all, which was kind of fascinating to make them think, well, this is where we all started going, maybe we need to give omega-3 as part of the therapy process. Because you look at a lot of these different sports, boxing, football, hockey have a lot of elevated risk, and other sports do as well. Soccer, cheerleading, there's a lot of different things that increase our risk, but these head rotational acceleration and deceleration forces put a lot of stress on the brain. What's interesting now is neurofilament light, ironically known as NFL. These are fibers in the brain that really show damage. When elevated, we see increases in brain axonal skeleton injury and TBI. So this is really what John Oliver started looking at when he did a study giving them DHA and looking at the biomarker of head trauma. Now, I think this is a fascinating study of how it was designed, because they looked at different levels of DHA, 2, 4, and 6 grams over the course of a season and looked at starters versus non-starters. So we're not going to have to go through the exact design, but what I found interesting was when you look at neurofilament light over the course of a season in starters, as you can see, as that season progresses, and as it should, a lot of microtraumas to the brain, elevated NFL levels or neurofilament light levels in the brain to show higher levels of injury in that brain that are occurring. As you can see, the non-starters, those that are obviously not playing in the game and probably not getting a lot of reps at practice, have less injury and less significant NFL levels in their brain. When we look at the treatment protocol, as you can see, there was a protective effect and obviously a recovery effect for those that received omega-3 versus those that didn't. Now, what's really interesting was the fact that the dosage that had the best response was 2 grams. 2 and 6 were pretty close, but it was interesting to see the significant difference between really 2 and 4 and 4 and 6. And obviously, placebo from 2 is drastically different in the impact and change from baseline on neurofilament light levels. So basically, this was kind of a start of a first study to look at the effects of omega-3 given to football players. And there's a lot more data in the pipeline that's going to be coming out to really see if this is the case. We're also going to be looking at other different ingredients. So I wanted to provide this. This was not actually going to be in the original presentation, but I thought this was just interesting enough to show the impact omega-3 has on the brain. So they did a study in individuals that were substance abusers, looking at assaults and anger level. And it was like 24 patients with a history of aggressive behavior and substance abusers. 13 patients received, and again, a small sample size, 3 grams of fish oil a day for 3 months. And they looked at their anger levels to measure behavior over 6 months. And what was pretty fascinating, and this is just looking at anger scores over the course, this is baseline and over the course of time, you can see the omega-3 group in black had significantly reduction in anger over the course of those 3 months versus the placebo group. This was quite fascinating too. So once the treatment started, the omega-3 level group, you can see anger levels went even down to lowest levels at 4 months and 5 months, and then as you can see, as the treatment stopped, that the anger levels started going back up. So quite fascinating to see in substance abusers the reduction in how they feel when it comes to anger. What's even more fascinating was the number of assaults, or the history of assaults in these substance abusers were significantly less if they took omega-3. So I just thought this was kind of fascinating and thought this was a little bit different to improve. Why higher omega-3 dosages? Because we need to balance the omega-6 to 3 ratio. We need to compensate for a lot of times people eating a poor diet. We need to saturate the brain for optimal healing in cases of TBI and concussion. So we need to raise those DHA levels and reduce inflammation through the delivery of EPA when we combine those. And again, it's not just one tool. It's not just the cure-all. It's just one tool that's going to use to help in the healing process. And if you're not using this as part of treatment of concussion, then in my opinion, we're not doing that athlete justice. There is enough data to prove that we need to have this as part of the protocol. Unfortunately, there's doctors and there's athletic trainers that still don't believe they have enough, and unfortunately, that's the wrong type of thinking. So again, it's not a cure, but it's an opportunity to optimize the healing process, and it will not hurt that individual unless there's a specific reason for them not to take that. All right, and we'll talk about dosages a little bit later. Let's kind of get into the athletic performance side. So we're going to go through some studies. I know looking at studies is boring. I think it's boring, but I think it's important that we have to look at this information in order to formulate an opinion. So we look at overweight, and we look at now omega-3 and body composition, BMI greater than 25 for these subjects. They had high blood pressure, cholesterol, triglycerides. Nice little hefty dose. I mean, I take 6 grams a day. That's usually what I typically recommend, somewhere in the 2 to 3. But if you want to get crazy, we take a little bit higher in the 6 grams a day, and compare this to 6 grams of sunflower oil. Protocol of walking 3 days a week, 45 minutes at 75% of your max heart rate, and looking at a bunch of things from lipids to body comp, DEXA, arterial function. And what they saw was the fish oil and exercise group had the greatest change in fat-free mass. So fat mass decreased quite significantly in the group, and also lean mass elevated. Now, we're going to talk about that shortly. Why would lean mass go up? We're going to talk about the anabolic effects of omega-3. So here's one study that showed some benefits when it came to body comp using a pretty high, hefty dose of omega-3. Also, looking at changes in serum lipid, fish oil at week 6 and 12 showed significant reductions in triglycerides and also improvements in HDL. So as we talked about earlier with the cardiovascular profile, an improvement here in these blood markers. Same thing with looking at brachial artery diameter, so improvement in blood flow. We've seen studies to show that fish oil increases cardiac output in blood volume and stroke volume. So, could this be also a way to help with blood flow dilation? What about metabolic rate and body comp? So this was a study done by Eric Noreen and his group, looking at another pretty decent dose of 4 grams of fish oil versus safflower oil every single day. These are healthy individuals, but they weren't really engaged in consistent exercise training. But they looked at RMR and body fat. Same thing, fat-free mass, your lean mass increased, fat mass decreased. Very similar to the study that had 6 grams. So 4 grams was just as effective as 6 grams at improving those outcomes. What I found interesting in this study was that cortisol levels dropped. So, a lot of people ask why. I mean, because RMR was not significantly different. We didn't see really a drastic change in RMR, maybe by about 50 to 80 calories. But salivary cortisol levels, a stress hormone, dropped significantly in the group that achieved omega-3. So what some of the really rationale for this was omega-3 will activate what's called the peroxisome proliferator activator receptors. So these are receptors that are involved in fat metabolism, cell death, and inflammation. So what they're thinking is because of the elevated omega-3 intake, it really allowed the individual to have greater reliance on fat for fuel during exercise while sparing glycogen. So it may have a positive effect on exercise by improving blood flow. It also may attenuate muscle soreness by reducing inflammation. And we're going to actually talk about that coming up. So the conclusion was the ingestion of EPA and DHA of about 1 or 2 grams as a ratio of EPA and DHA 2 to 1 may be beneficial at counteracting exercise-induced inflammation for the overall athlete health. So let's kind of really see what happens when that does occur. So usually when we have some type of tissue injury or inflammation, higher omega-3s and a drop in omega-6s have shown to improve healing and have a complete resolution of that injury. Now again, we don't know the time frame. Every athlete's going to be a little bit different on how quickly they recover, depending on the severity and the type of that injury. When omega-6s are elevated and omega-3s are reduced, then we have chronic inflammation and it could slow that healing process. So if you have an athlete that maybe has an ACL tear, maybe is looking at a labrum tear in the shoulder, all my baseball pitchers that I work with, we always do omega-3. That's an important component of the recovery process. So if they're pitching and they don't pitch again, if it's a starter for another 5 days, they should be taking a good dose of omega-3 to help that recovery process. Now let's look at inflammation and recovery. Here's Richard Bloomer's group that looked at EPA and DHA on exercise-induced inflammation and oxidative stress. Another hefty dose of about 4.4 grams of equal to EPA and DHA, and looked at pre and post markers of inflammation and oxidative stress. And the way they did this was 6 weeks of supplementation, an 8-week washout where they did the test session in between, and then another 6 weeks of supplementation. And what they saw was C-reactive protein was significantly less in the EPA DHA group, as you see in that top left, and also tumor necrosis factor. These are both 2 markers of inflammation in the body. And they also saw an increase in antioxidant capacity. Not really significant, but still at certain levels, yes, but in other levels, no. But still an increase in antioxidant capacity combined with a reduction in inflammation in both of those markers due to the EPA and DHA supplementation. Again, looking at another group of performance of well-being of heavy eccentric exercise. And this was kind of interesting because they looked at omega-3 index scores on the outcomes of healthy young adults after intense eccentric exercise. And as you guys may know, eccentric exercise is really where a lot of the muscle damage occurs. So if we can get omega-3 indexes elevated, does that improve certain markers and blood markers like C-reactive protein, creatine kinase, and blood lactate? And they looked at these over the course of several days. So here's what we saw was the comparison of delayed onset muscle soreness was significantly lower, especially around 24 hours in those that had an omega index score of 4. Now, as we talked about earlier, you really want a score of 8. 8's where you really reduce your risk of cardiovascular disease. But really the 48, the 72 hour was really the window. That was where it was really significant, where if you had a score above 4 versus a score lower than 4, you had a lot more soreness if you had a score lower than 4. And it started coming back to baseline, but still that group that had a higher score had less onset muscle soreness and better recovery. Same thing with CRP levels, higher score of 4, 24 hours, 48, 72, pretty much very little increase in CRP, whereas you can see the group that had a lower score, significant increase at 24 hours, and eventually around 4 days later came back to baseline equal to those with a higher score. And then, of course, we look at performance, you look at torque and power, and you can see here the omega-3 index group greater than 4 had significantly more torque pressure and power than those that had a lower score. So could there also be a performance enhancement benefit for strength when looking at omega-3 based on our scores? This is a study I just kind of came across recently and wanted to throw this in here, looking at muscle soreness as well. Non-resistance trained females, a nice dose official of 6 grams per day. And the way they did this is pretty interesting, where they gave supplements for 1 week and then underwent 10 sets of elbow flexion and leg extension exercise to failure. So that's a pretty, it's not that it's a long bout of exercise, it's just intense because you're exhausting that specific muscle. And then looked at visual analog scores over the course of a week, 48 hours and 1 week post-exercise, looked at soreness while they did functional movements, and what they saw was in the omega-3 fish oil group, soreness was 33 to 42% lower versus placebo. And that's quite significant because recovery means so many different things. It's not just, it's glycogen replacement, it's muscle soreness, it's pain. So if we can help athletes feel better the next day or throughout the course of a season, can that improve how they perform? And that's the one thing we would love to know. Here's kind of the first study that came out last year, really interesting on looking at muscle growth and recovery. The role of omega-3 doing muscle growth and regeneration. Does it have an anabolic response? So, and what they found from the outcome of this study is omega-3s can modulate molecular signaling for muscle growth and hypertrophy. What it does is it activates those muscle stem cells, which drives skeletal muscle repair to damaged tissue from exercise, and it also stimulates muscle protein synthesis. So after exercise, we focus on protein and carbs, We throw in some cherry juice. We should throw in some omega-3. And I'm going to show you some of that a little bit later and really how much should we have. So we have a lot, obviously, data from the inflammation side, from the brain side. Now we have data from maybe the muscle recovery side. We do need more. Obviously, this was just one study, but we do need to look at high-intensity trained athletes to see, does it have the same response? So the question is, are you eating enough omega-3 and should you take a fish oil supplement? If you're eating foods that are rich in omega-3, then no. If you eat a ton of mackerel or salmon and, halibut and fish that have great omega-3 levels 3, 4, 5 days a week, you probably don't need a supplement. Most of us are not eating those type of foods. But the omega-3 supplementation is really an easy and convenient way to increase omega-3 levels in our blood, and it helps balance that 6-to-3 ratio. My typical recommendation for general health, 3 to 6 grams a day. Obviously, the 6 grams is a heavy, heavy dose, but it's not going to cause bleeding. A study just came out probably 3 or 4 months ago that looked at omega-3 during surgery. There was actually less bleeding because of the omega-3 therapy. So I think we get so concerned about that. I'm more concerned about how much fast food people are eating, because if that was really a significant outcome, certain countries would have a ton of bleeding. Eskimos and Okinawans and people and Japanese people, they'd have a ton of bleeding because they take a lot more dose from food sources. So again, if you eat 3 or 4 ounces of salmon, you're going to get a hefty dose of omega-3 that we need, but we're going to fight a lot of the inflammation that's happening in our body. Body comp inflammation, usually 2 to 4 grams per day is a great place to start. If you're not taking any, start with about 2 to 3 grams per day. For the fish oil protocol for concussion and TBI, again, going back to Dr. Michael Lewis, I was fortunate to speak at a conference with him and kind of look at his recommendations, but he usually recommends somewhere from 9 to 12 grams a day once, the week 1 of a very intense concussion. If somebody had a pretty intense concussion, they start out a pretty hefty dose of 9 to 12 grams per day. Then they back off as those symptoms improve and then go to a maintenance dose around week 3. So this is kind of Dr. Lewis's protocol when it comes to concussion therapy. But we still don't know what's the ideal, and that still needs to be studied to really come up with a true clinical dose. What form of fish oil is best? We get this all the time, is, what type should I take? And there's a lot of good data to kind of, there's definitely several different forms. Obviously, we look at ethyl ester, we look at triglyceride-based krill, we look at cod liver oil. There's a lot of different forms of fish oil that do a really nice job. But here's a study that looked at the bioavailability of marine N3 fatty acids on the formulations. And what they did was they took 72 subjects, split them up evenly between gender, and excluded them if they took fish oil within the last 2 months. They randomized them to 6 groups: triglyceride-based, ethyl ester, fish body oil, cod liver oil, free fatty acids, and corn oil. And 4 groups were double-blinded, where they gave them 5 capsules twice a day. And I'm going to show you that table in a second. And 2 single-blinded groups given cod liver oil or fish body oil. So what they did was they looked at the total EPA and DHA intake and that ranged from 3.1 to 3.6 grams per day. And here's kind of the outcome. So you can see a triglyceride base all the way, ethyl ester, free fatty acid, and even the cod liver oil, they had to give them 24 capsules within the day to get the same dosage. So you can see the highest intake was in the free fatty acid group, and the EPA DHA group for those, and triglyceride base was the lowest. Corn oil actually had 0, so that was the placebo. And what they found was, when you look at EPA and DHA, triglyceride-based fish oil had the highest scores and highest levels in the concentrations in the body, where ethyl ester, which is the most common form of fish oil we see sitting on the shelves of most stores, had the lowest, besides corn oil. But we did really, that's your control and placebo. So that's pretty much across the board. In some cases, though, in EPA, you had free fatty acids, you had fish body oil, but in DHA levels, cod liver oil was superior. So nothing wrong with cod liver oil. That's another great source of omega-3. I particularly like to stick to triglyceride base. There was another study that looked at the same outcome, looking at 3 different types of manufacturers' recommended dosages based on omega-3 fatty acids, and looked at phospholipid from krill, looked at triglyceride base, and looked at an ethyl ester. And what they kind of looked at was just the dosage, different dosages, and again, based on this, these were dosages based on what was recommended. You'll see, obviously, some had higher, but krill typically has, very low dosages per capsule. So that's why usually you would have to take a lot more krill to get the doses that you would get from other types and forms of fish oil. So 28 days of fish oil supplementation followed by a 4-week washout. And what they found was the triglyceride-based fish oil had significantly higher bioavailability, but also increased omega-3 blood levels compared to ethyl ester, salmon oil, and krill oil. So still, there's been some studies to show no difference. Ethyl ester and triglyceride base were similar, but the majority of the data that we've seen, there's about 7 or 8 other studies, because I don't want to list all of these studies and just spend all this time looking at comparison. 7 or 8 other studies show triglyceride-based fish oil is going to be superior in those cases. And this kind of just shows the cost for those in different products. And again, when we look at products, we have to look at certified for sport-based products. This is extremely important to make sure that anything we use has the NSF for sport certification, because there are a lot of different brands out there. There's a lot of people selling products, and if we're not using NSF certified for sport products, then we run the risk for potential contamination. We've seen what happened to certain athletes over the course of time, not from taking fish oil, but just from taking products that were not third-party certified. So 2 NSF products by Nordic that are certified, that Ultimate Omega for Sport, which has been around a while, and now their new Omega Sport 2 times. You can see the dosage, a great dose in both, but that 2 times product has 2 grams of fish oil per 2 capsules, and that's great because that's usually what I recommend people start with. My recommendation for my athletes, and again, everybody's different, and there's no really, this is the perfect protocol, but I typically, at least like to spread the doses out throughout the day, not just, take them all at once. If that's what has to be done, then that's fine. That's better than getting nothing at all. But 2 capsules in the morning with food, with breakfast or lunch, 2 of the Ultimate Omega Sport, 1 of the Sport 2 times, because you're getting a nice little dose there. And then post-workout, if they work out in the afternoon, then 2 capsules of the Ultimate Omega Sport, or 1 to 2 capsules of the Sport 2 times. If they work out in the morning, then you just reverse that. You make sure after their workout they have this with food, and then later in the day they take another dose just to kind of spread it out. Because we're going to take our omega-3 in the morning, we're going to eat. They're probably going to have some omega-6 driven type foods throughout, and that's fine because most of the foods we eat are going to have omega-6. So that way they have a little bit of balance of omega-3 in their blood throughout the day. Really, in summary, then we can leave some time for questions, is this is a very versatile nutraceutical. It's something that we have to consider taking if we're not using currently. We need to increase the omega-3 from food and supplementation to balance those levels, as we talked about. But most importantly, if you eat it from food, great, you don't need to supplement. But if you're not eating it from food on a regular basis, then we need to consider good quality supplementation. But we do need more data. We need a lot more data to expand upon this. And there's a lot of great data out there. I mean, if you go to omega-research.com, that's an incredible resource. And I use that all the time to look at updated data that they have. So we need more research to look at this. But as the data that we currently have, I'm convinced, especially for the concussion side, if this is not part of the treatment protocol, then I think we're behind on our times, because it's obviously there's a lot of important outcomes that could be used for this type of treatment. And again, start small, 2 to 3 grams per day. I personally take 6. That doesn't mean that's the right dose, but I like to saturate my body with omega-3. I like to have high scores of omega-3 index, so I personally take a little bit more just because I take a little bit more. There's no reason to do that. Triglyceride-based fish oil I feel is best for bioavailability and absorption. There are other good forms of fish oil you can take as well. And talking to Dr. Lewis, the one thing he has concerns with ethyl ester-based fish oil is it can be hard on the stomach. It's not the ideal when it comes to stomach health. Not sure what outcomes happen, but it'll be interesting to see. I've had certain individuals say, hey, I was taking this other product, which was an ethyl ester base, and their stomach was hurting. So again, another anecdotal report, but at the same time, it's feedback that we have to use to try to make better decisions. If you guys need to reach me, this is my contact information. If you want to reach me at any time to answer any questions, whether it's related to this topic. So I think I will turn it back over to Katie. Thank you guys for the time, and we should have about, I guess, 10 minutes for questions.
Fantastic. Tavis, thank you so much. The questions are just pouring in. Are you ready to field some of those?
Oh, I hope I can answer them.
Okay. All right. We will start with this one here. What are your thoughts on the new, I believe it's S-MEDS or SMEDS formulation versus the triglyceride, ethyl ester, etc. forms of fish oil?
Wow, I don't know because I haven't seen it. So I'll be completely honest and transparent. I will look it up right when we get off this call. So I'm not familiar with that formulation, and if there's data behind it, then great. Let's take a look at it because there's never one thing that's always going to be the only thing. So we have to look at other options as well. If that's a great form, then we need to look and see what that is. But I'm not familiar with it at all.
Perfect. Okay. The next one is the omega-3 index test influenced by recent dietary intake of omega-3s, or does it look at long-term intake or stores? Do you know?
Yeah, they look at all different fatty acids. It's not just omega-3. They're looking at all your fatty acids in the blood. And yes, dietary sources will impact that. So you don't have to supplement to get this test done. If you want to get this test done now and you're not eating a lot of dietary sources, then definitely do that. So yeah, it looks at all your sources of fatty acids in the body. It tests for saturated fat as well.
Wonderful. I have a question about mercury presence in fish oil supplements, and what do sports RDs need to know about that?
Yeah, I mean, that's where testing comes in, testing and purity. So that's where you have to look at the company and see what their testing guidelines are. If they're not testing for these raw materials and these toxins, then you have to be extremely cautious. And there's a lot of different tests that go on, and that's what I love about Nordic is they have tons of different testing protocols throughout their process to ensure that levels. There's going to be mercury in these products regardless, but it's about keeping the levels as low parts per million as possible. So as long as they have good manufacturing practices and good manufacturing facilities to ensure that these toxins are at minimal level, then we don't really have a lot of risk for doing so. And really the types of fish that are used in some of these supplements are very low in mercury anyway. I mean, if you're using tuna oil and certain other types of fish, shark and certain cartilages, then we have a higher risk. But the certain types of fish that are in a lot of fish oil are usually low in mercury in the first place. But that doesn't mean we don't have to be cautious. So that's where testing for the company comes in.
Perfect. How can you tell on a product what its formulation is, if it's triglyceride or if it's ethyl ester based?
If the company only discloses that, so you don't know. And that's why companies that are transparent, that want you to know it's triglyceride based, will put that on the label. If they don't, 99% of the time, it's going to be an ethyl ester or probably some other, oxidized form.
Great. Can you talk more about the timing of fish oil and why that might matter, especially when it's around exercise or not around exercise in terms of recovery?
That's a great question. I mean, there's not really data to say this is the best time to take that. I look at, I guess, overall intake and want to spread out the omega-3 dosage, just like if you want to balance out protein throughout the day. We don't want to just take a big bolus dose of protein of 200 grams and try to eat that in one meal. The data shows it's better to spread that out. We don't really have the data yet to say what's the best time to take fish oil. As far as I know, it may be out there. I just haven't seen it. But when I look at the way we eat, when I look at our dietary schedule, I feel it's better to spread this out as opposed to taking one big dose at one specific time, especially in athletes, because you have some athletes that are training twice a day. You have swimmers that are going to swim in the morning and swim in the afternoon. So I feel it's better, especially for some of these multi-level athletes that are doing multiple things throughout the day, is just to spread this out to maybe combat inflammation and also reduce maybe the balance of omega-3 to omega-6.
Awesome. There's a couple questions in here about vegan omega-3 supplements. Can you comment on the difference between a vegan supplement and a fish oil?
Yeah, algae oil is great. I mean, that's where algae oil comes in. That's fine. That can still raise blood omega-3 index levels. I haven't really seen a lot of data comparing that though, but it's very effective. I mean, it's something that a lot of these companies have, so they know. I mean, we have a lot more vegan athletes and a lot more vegan customers that are looking for those type of products. So we have to, those companies have to cater to those needs. And a company like Nordic has a wide variety from cod liver to fish oil to algae oil to cover those type of individuals as well. So that's a very great source of omega-3 that can still raise blood amino acid, not blood amino acid, we're talking protein, blood omega-3 index levels.
Great. Let's see. There's so many of them. How about this one? Questions on the best way to store fish oil. Does it have to be in a refrigerator, in a dark bottle? What do you know about that?
Yeah, room temperature. That's the key, is making sure it stays room temperature. If you have a liquid, I always, when I take liquid, I take 2 teaspoons a day. After I open it, it goes straight to the refrigerator. So I just do that for preservation. Also, I like it cold versus warm. But in talking to the manufacturers, the best way to do is keep it at a room temperature environment.
Excellent. And then I can group a couple of these together. Considering budget constraints that some people individually have, would you recommend a smaller dose for people who are kind of on a budget versus no dose at all? Or what do you think on that?
Yeah, absolutely. I mean, a little dose is better than no dose whatsoever. I mean, if they can get it from food and fish and they can't afford supplementation, completely understand. So we have to figure out what works best for them and, work within their budget. Absolutely. So getting, even if it's a half a gram or 1 gram, that's better than getting no grams at all.
Great. And then what is your advice around dietitians who are just starting to write supplementation policies and procedures, maybe in response to the legislation that was recently passed? Where would you recommend kind of starting, and what would you recommend looking at when you're creating those?
That's a tough question for me to answer. I guess, what is the outcome they're looking for? Is it more, are we trying to write these policies to get our sports med team and our team docs on board? Would that be the outcome?
Yep, that's what it sounds like. Just looking to kind of standardize the process potentially and get docs or sports med to kind of sign off, essentially.
Well, I can tell you one thing that I'm doing right now. I'm working with Nordic. We're actually putting together a big packet. And it's going to have all the data around omega-3 for all the different topics that we discussed today, as well as more. So I think having, obviously the science for these individuals, because these individuals want science. You just can't go in, whether it's vitamin D or whether it's whatever it is, turmeric or fish oil. You can't say let's use this without having some evidence. So I think this booklet we're putting together, we actually launched it like 2 years ago, but we're going to revise it and come up with a lot of the new science to really say here's why I feel this is important for our athletes. And it's a tough group. You're going to have some stubborn people that just, no matter what you give them, they feel their way is better. And it's really, in their case, is probably to protect themselves. But unfortunately, you're going to have newer physicians that are going to think outside of the box, new athletic trainers that think outside of the box. So again, we have to show them the science. I think that's going to be the most important thing to convince them to be open to do a lot of this. And I know starting out, where do you start? And that's a tough question to really figure out what's the best approach. And I'd love to know more about because I'm not in that setting anymore. I'd love to know what others have done, veteran sports RDs that have had success in those settings.
Awesome. A question about if you believe that body weight impacts the amount of fish oil somebody needs, or omega-3.
Yeah, I don't think this is like protein. I think, if someone's 100 pounds versus 300 pounds, I don't think we increase the dose. At least we don't know that yet. I don't know if there's been studies to look at the size of the individual, because it's like saturated fat. You eat a lot of saturated fat, it's going to increase probably your LDL levels, whether you're 100 pounds or 300 pounds. I don't know if the rate of elevation goes up faster or slower based on body size. So that's a question. I don't know how that impacts based on weight, because, things like protein, we do it, gram per kg. We don't really do that with fish oil. We just say take 2 or 3 grams regardless of weight. So I haven't seen any data to really examine that or provide you with a good response.
All right, just a couple more. I think we might actually make it. Next one is any validated studies that support omega-3 use in the treatment of concussions?
Can you ask that one more time?
Yeah, they're looking for a validated study that supports using omega-3 to treat concussions.
Yeah, I mean, the John Oliver study, the one we mentioned, I mean, it showed that it reduced neurofilament light significantly compared to those that did not. 2 grams was the ideal dosage. And that to me is the study right now that says, hey, take this to your athletic trainer, take this to your physicians. If we're not using this, and again, I know it's one study, but it's enough evidence to show, why aren't we even trying this? It's not like we're taking a risky pre-workout that has multiple stimulants and we're trying to do something that we know is going to elevate heart rate and blood pressure. We're taking something that comes naturally from food. So again, I find it odd that people are going to be, I guess, have pushback for something like this, because even though it's one study, I find the data conclusive enough to at least give us the ability to start trying it out as part of the process. Because there's no other treatment right now for omega-3. We're looking at other things. There's other scientists looking at things like creatine and turmeric extract or curcumin, which both pass the blood-brain barrier, but and they should be also utilized in that treatment protocol. But omega-3 is still the gold standard when it comes to brain health.
Awesome. And last one here, I can group a few together and ask about the omega-3 index test. If one wanted to get these, how would they go about it, and how much do they cost?
I think the cost I saw the other day was like $79. There's a company I think called Omega Quant. They're a group that does testing. I think there's 2 companies that actually do testing. Omega Quant, I think that's Doug Bebus's lab, and I think there's one other company. Katie, I can get you guys that information, and we can share it with those that were in attendance. But I know there's one for sure, and I think there's another one as well.
Sounds great. Well, Tavis, thank you so much. That's about all the time we have, and I appreciate your willingness to fly through all those questions. Thank you, everybody, for joining us today. We hope that you found this information really useful. We will be posting a recording of this call to our webinar library on sportsrd.org. So thank you all again, and have a great day.
Thank you guys for having me. I appreciate it.